coverings. Put your hand on the inside of the shoe covering. Then sit down. Match your hand with the bottom of your sole while using the other hand to put it over the top of your toe. Do the same thing with the other shoe covering. Opposite hand, put it over your toe, and the other hand can guide it over the heel. Next, we will get the head covering. Put it over top of your head, covering your ears. Ensure that all hair is tucked inside of the head covering. After this step, we'll put on the mask. Put the mask on the front of your face. Put the straps around your ears, and make sure to mold the metal piece of the mask to cover your nose, ensuring that no air can get in or out. The position of the mask is in the correct spot and will not cause any irritation, because once this step is completed, you will not be able to adjust the mask later on. The next step is the hand washing stage. First, you will ensure that all supplies are set up and that no jewelry, artificial nails, or nail polish are left on the hands. Next, we will wet both of our hands from fingers to elbow. After this stage is done, we will apply some hand soap and perform a basic hand wash, while making sure not to touch the inside of the sink and keeping hands above your elbows and away from your body at all times. After the basic hand wash is complete, we'll do a rinse from fingers to elbows. Grab the stick. This will be used to clean under the fingernails, as they're a great place to host bacteria. Another microorganism. Make sure to do this under running water to rinse out any debris. After the stage has been completed, we'll discard the stick brush into the sharps container. We'll grab the scrub and clean the outside of the fingernails. With all fingernails lined up, we'll perform 30 strokes. Scrub brush to clean the hands. Each finger is divided into 10 planes and will need 10 individual strokes. Also, the webbing between each finger will need 10 strokes each. For the sake of this demonstration, we may not have 10 strokes per plane per finger. Isn't scrubbed, we'll scrub the arm. The arm is also divided into 4 planes and will need 10 scrubs per plane. After each plane has been scrubbed 10 times, we will transfer the brush into the other hand and do the other arm. The final step is to rinse your arms. Keeping your hands above the elbows, rinse for the final time, ensuring the rinse water flows from fingertips to elbow. After this, we will go to the puck towel to dry your hands, keeping your hands above your elbow at all times. After washing your hands, remember to keep your hands above your elbows from this point forward. Next, grab a sterile dry towel to dry your hands off with. While one hand controls the towel and dabs the other hand from top to bottom, never going from bottom to top. Then the other hand will grab from the bottom, flip the towel around, and do the same with the other hand. After, simply drop the towel on the ground and allow your circulator to grab it later. Taking one step forward, grab the gown from the inside and put your arms through the armholes. Let your circulator come to tie up the top of the gown. The next step is the gloves. Ensuring that your hands are still above your elbows, keep your hands inside of your sleeves. Do not let them come out. Next, the circulator will pop open the glove onto the sterile surface so as not to contaminate anything. You'll have to open the gloves without letting your hands out of the sleeves. Once the gloves are ready, you'll have to put them on while still keeping your hands inside of your sleeves so as not to contaminate anything. Make sure to put your non-dominant hand on first. After the glove is on, make sure that no skin is exposed, especially the wrist. After your non-dominant hand is on, the glove is on your non-dominant hand, you'll put the glove on your dominant hand using the same technique. Look how no skin is exposed on either hand. The next step is to grab the paper and undo the front of your gown. Wrap the paper around the one drawstring and hand it to the circulator so they can grab it from the other end of the paper. Next, the circulator will go around the back and tie up the bottom part of the gown. After this step has been complete, you're ready to go into the surgery.